Hello everyone, this is Audio Fingers with a relaxation audio massage video for you. I hope everyone is doing well and is ready for some nice relaxation. You may have just come home from work, or you may be getting ready for bed, or you may just be looking for a bit of time to relax and unwind. Whatever it is, just take a bit of time for yourself to relax and feel good. Of course, don't listen to this audio if you're doing anything at all that requires that your eyes be open. Clearly that involves conducting a motor vehicle, amongst other things. I do encourage you to find either a comfortable chair or your bed to lay back and relax on to help you enjoy this more fully. So I want you to take a deep, deep breath, hold it in, count to 5, hold it in, and then hold it for 2 or 3 seconds. And then exhale as if you're blowing out a candle. And then repeat this. Breathing in deeply. Hold it for 2 or 3 seconds. And then exhale out the mouth as if you're blowing out a candle. And give yourself a few seconds between each breath if you can manage it. You will feel yourself begin to relax. And just imagine yourself. Imagine that you're sitting cross-legged, sitting up straight, and I'm also sitting cross-legged behind you. And then I place my hands gently onto your shoulders, and you feel the warm strength of my hands grasping your shoulders, gently yet firmly. You feel the warmth of my hands touching the warmth of your skin, and you feel yourself becoming less and less tense. You feel yourself relaxing and dialing down your tension. I don't typically use any oil because I like to feel a very direct tactile contact between my hands and your body, so that you can feel as my hands become slightly sweaty, how they gently pull on the skin ever so slightly as my fingers, the pads of my fingers, move around on your trapezius. You can feel them as I roll my fingers over top of your trapezius muscle, a muscle between your shoulder and your neck. And then I begin to squeeze them a little bit more firmly. I'll squeeze them, and you can feel the fibers of your trapezius beginning to unravel. I gently warm the tissue. I warm the tissue between my fingers and the ball of my hands, gently massaging them, warming you up, just as if there were a rope that had molasses, and I'm trying to get the molasses out. I'm working out the knots as I warm the tissue, warming in the molasses until it begins to slowly melt, slowly melt in the warmth of the sun. And I continue moving just my fingers as if I'm playing an instrument almost, touching the pads of my fingers, pinching just the skin now, between my thumb and my forefinger and my middle finger, squeezing and playing with the skin, bringing blood to the surface. Feels just ever so slightly rubbery as you feel the light traction on your skin. You feel it warming and you feel it relaxing, and you can feel the adhesion slowly beginning to let go as I lift the skin away from the muscle gently. And then I move just between my thumb and my forefinger, pinching your trapezius closer and closer to the base of your neck. And I pinch the base of your neck as the trapezius joins your neck, ever so slightly, pressing more and more firmly, moving my fingers, rolling the muscle between my fingers as it begins to gradually let go. Then my other fingers join in, pressing against the palm of my hand, feeling your trapezius begin to melt on the left and right side as my thumb and forefinger work right next to the neck and the rest of my fingers work right next to the ball of my hand, squeezing and squeezing and squeezing your trapezius as you feel it letting go and letting go and continuing to let go. And I move my hands further outward to the outer side of your shoulders, to the deltoids, grasping your left and right shoulder, my left and right hands, working right around the ball of your shoulder with all of my fingers, pressing on them, putting just a bit of pressure on them to begin to loosen the tissue, pressing the ball of my thumb in right in the center, getting them to be relaxed slowly and gently. And then finally I apply just a bit, very bit of light oil, and only a tad, onto the upper portion of your back. I gently put into my very warm hands 2 or 3 drops and spread them out onto the top of your back. And then I glide my hands back and forth, and then I take the bottom of my thumbs and I press from the outer portions of your shoulders onto the lower part of your trapezius and gently move from the right to the left in towards the center as my thumbs press on your lower trapezius, pressing just like zippers, pressing on them till they get to the center, and you feel your trapezius being unzipped and released. And I go back and forth several slow, delicious times over your lower trapezius with my thumbs pressing in. Not going deeper just yet, wait until the tissue gets warmer. Ever so slowly, you can actually feel individual fibers of your trapezius being relaxed by my thumbs, as if it were tightly wadded rope that is being manipulated gently to remove the knots of that rope. And then I grab all my fingers and I begin to wring the skin around the lower trapezius, your upper back. I begin to wring the skin, pulling it away from the adhesions or the fascia, lifting it up off the fascia, gently squeezing it, not even touching the muscle now, just working the skin, grabbing it, wringing it, squeezing it gently. You can feel it being pulled away from long-standing adhesions, an increase in healthy blood flow to the area that will take away toxins. And then I'll take my thumb, my index finger, my middle finger on the left and right side, and again begin to push towards your middle trapezius from the outer ends, pressing on them, gliding over the skin, pressing firmly into the tissue as I move towards your neck on the left and right side, pressing on the center of your trapezius right down the middle and releasing tension there. And then I place my hands on your shoulders, the palms of my hands on your shoulders, and then slowly slide from the side of your shoulders up the top, and then move ever so slowly over the top of your shoulder onto the top of your trapezius. And all you feel is the warmth of my hands. And I hold, just hold the top of your trapezius and allow you to feel the warmth. Then I begin by applying just a bit more oil up the top of your trapezius and into the lower part of your neck and up to the base of the occiput. And then I gently squeeze between my knuckle of my index finger and my thumbs and begin to squeeze the muscles of your neck. And then I rub my thumbs up and down slowly from the attachment of the trapezius into the neck onto the muscles of the back of the neck, all the way up slightly into the hairline, into the lower portion of your hairline, and then up and down and massage. I feel the tension being released as I take all of my fingers and gently trace them on your forehead ever so slightly so that it tickles, and then drag them down the sides of your face, down your cheeks, and then up again ever so lightly. Yet your skin strains to feel the sensation, it's so slight. And then I take the palms and then I spread slowly and deliciously down your forehead and your cheeks, pressing in the sensation of the tickling. And then I move my fingers to your scalp, putting my fingers through your hair, directly on your scalp, and squeezing gently all my fingers on my left and right hand, squeezing all around your scalp, the top, the sides, the middle, in perfect synchronization on the left and right side of your scalp with my hands. And then I press my palms onto the top of your head and squeeze large areas together. And in conclusion, I take my thumb and forefinger between your eyebrows on the left and right side, gently squeeze it into a more firm squeezing, and then slowly, as I firmly press to the left and right, pulling to the left and right side, spreading your eyebrows away from each other. And I repeat one more time, put my fingers on your eyebrows from the center, pulling your eyebrows slowly away from each other. And then my fingers and my hands touch the top of your head, and then my fingers alone go down your forehead slightly, go down past your closed eyes, past your nose, past your cheeks, lips, chin, and neck.